Awesome. Well, welcome. Good day and welcome to today's webinar on scaling virtual care and navigating challenges in infrastructure and workflow. I am Grant McGaw, and I'll be guiding you through today's insightful discussion. The landscape of healthcare is evolving rapidly, and with virtual care at the forefront of transforming patient experiences and operational experiences, today we will be joined by a distinguished panel who are at the intersection of healthcare innovation and technology. First, we have Ronak Shah, an accomplished software developer renowned for his contributions to web and mobile application development in the healthcare sector. And next, we will welcome Dr. Eric Eliayev, a forward thinking physician who has successfully integrated virtual care solutions to enhance patient care and outcomes. And last but not least, we have Vedette Perez, a chief information officer with extensive experience in technology infrastructure, ensuring that our leaps in healthcare technology are both effective and produce positive outcomes. Now, to kick things off and tailor this discussion to your interest, we'd like to hear from you. And I'd like to know, what area of virtual care are you most interested in? That could be development, patient experience, or strategy. So please let us know by interacting with us. Put your answer into the comment section, and your input will help us shape our conversation today. So we'll first start with navigating complexities in virtual application development. And I'd like to direct this first question to Ronald Shaw. Ronald, can you outline some primary complexities in developing virtual care applications and how Agile InfoWays approaches these challenges?
Sure, Grant. Thank you for the question. Sure. See, many virtual applications, they really need to integrate with the existing EHR systems, the billing systems, the scheduling systems, and the overall healthcare IT infrastructure, And so understanding the virtual care solution and at the same time, the understanding the overall detail aspect of the EHR is very, very important. So Agile InfoWiz brings that experience of understanding the both sides as far as the integration goes. There are a lot of compliances which is regulated in different parts of the world. So for example, in US, we have a HIPAA compliance. Or let's say if we are designing a solutions in Europe, it's like GDPR compliance, so the development team, the business analysts need to know all these different strict regulations as per the different geography of the world and need to make sure that virtual applications are compliant with all these regulations of by the government. Now, data security is also very important because when you're using virtual care application, a lot of data is being traveled on cloud premises to the directly virtual care applications. And there are definitely the issues of like unauthorized access, data breaches, or cyber attacks may even take place. So it's very, very important while designing this kind of application, you should have a multi-factor authentication in place. The intrusion detection system should be in place, and there should be a lot of regular security assessment that needs to take place, like penetration testing. You need to do those kind of tests every few weeks to make sure that there is no vulnerabilities in the overall solutions. Now, if we look at the virtual care applications, these are being used by either patients or healthcare providers. Now, these patients or healthcare providers are not really tech people, they are end users. Now, in the patients, there is different age criteria. There could be older patients, elder patients, they're using it. So the user experience is very, very important. Like when you design this solution, you have to keep that in mind that the end user should be able to schedule an appointment, do the video conferencing with the doctors, or chat with the doctors or the remote patient monitoring team very easily and seamlessly. So you have to do the full user experience structure in such a way so it's very easy for even the old patient to use the system. The most important part in the virtual care application is the scalability. Like last year, in the year of COVID, we designed one very big virtual application which was implemented in 1,200 hospitals in America. Now when we did that, we did see that we have thousands and thousands of video calls going on every day, and the scalability to support this 1,200 hospital is not that easy because it's COVID time. Nobody was going in, so everybody had to do virtual care with their doctors. So designing the scalable architecture on the cloud front, like we do a lot of work with AWS. We are AWS certified, and we brought a lot of stuff from the AWS. So you have to make sure that the cloud infrastructure, whether you use AWS or Azure or Google Cloud, everything should be well defined in the virtual care application. Now interoperability with the medical devices, because this virtual care application talks with wearable devices, smart sensors. When we install this virtual care application to on the patient's premises, there is a lot of communication that takes place through the IoT devices. Now, securing those APIs or SDKs is very important because the data is traveling from IoT devices to the virtual care application or on the cloud premises, and that is easy to hack those devices very easily. So you have to make sure that security. So Agile brings that vast experience to make sure that the security is well defined. Yeah. So
Mhm.
Grant, I would cover this part as a part of this question.
You opened up a whole lot there, taking us through the journey of what virtual care really looks like from your lens as a software developer. I want to now talk to Dr. Eric because you brought up some things about around patient, the physician, the entire experience. So, Dr. Eric, as a physician who has embraced virtual care, from your perspective, how has virtual care transformed patient interactions in your practice, and what are some of the key factors in enhancing the patient experience?
Uh, Thank you very much for that question, Grant. And it's really phenomenal to be here with everybody on this incredible show. Um, it's a really important question. I have to tell you, what we do, all of us, is our goal is to save people's lives, right? Whether you're a physician, whether you're a technologist, wherever you are. So like when you're talking about virtual care, one thing I want to talk about is accessibility, right? So first thing is accessibility. And let's think about a real life story. You have a patient who in 1970 would have thought they have redness in their skin, an infection. They would have thought, you know what, it's going to go away. Let me make an appointment. Let me call my doctor. And they, a day would pass, two would pass. They would call the doctor. The doctor would say, we have only in 5 days an appointment. Okay, so then they would wait 5 days. In the meantime, this infection is getting worse and worse and worse. Cellulitis inside the bloodstream, infection, boom, hospitalization. Now let's fast forward. In 2024, we have accessibility. I have a patient, let's say, who has redness. Okay. That patient can now say, hold on a sec. Let me go on ZocDoc. Let me go on another platform. Let me book an appointment. Who's available? Oh, this doctor is available right now. Wonderful. They'll be able to see the doctor like this, like you and I, and say, hey, doc, let me take my phone and let me direct it over here. The doctor will say, is it warm? Is it painful to touch? Go through the criteria. Or maybe even AI now in the future will do those things, right? As we're going towards that.
Yep.
The doctor will say, I'll prescribe an antibiotic. Same day, no waiting, no ICU. We've just saved a life. So that's simple things like that. If you break it down to the simplicities, it's accessibility. Then we talk about early identification and prevention, right? So think about Ronak really did a great overview, really spoke beautifully about hardware as well, integration. So think about a patient having a blood pressure device at home. And back in the day, you would see your doctor once every, what, 3 months? Yes, Ronak, once every three
Yep.
months.
Yep.
Nowadays, and then I would go to the doctor and be like, oh, here's my blood pressure. Everything's great. Okay, goodbye, nothing. But nowadays, through remote patient monitoring, every day my grandmother takes her blood pressure. Her doctor can see the results in real time. We have the technology. Ronak has been designing that technology, right? We have the opportunity. And so think about a grandmother who has blood pressure in 170, 180 continually, and the doctor now identifies that second or that week. What's the most common cause of stroke? Hypertension. And in a
Yeah.
stroke, right? You can't, your lips go like this, you can't move your hand, you can't speak, you lose essential function. Whereas here, through a simple thing like remote patient monitoring, you can prevent all these things. So I'm in love with virtual care. I've been known to coin the term, we are taking medicine from Blockbuster to Netflix, right? From
Nice.
the
There you
block
go.
to the Netflix model. So I hope that's an answer that folks can relate to.
That is a great answer, great visualization of how we can transform the experience of healthcare to something that maybe you only go physically to see the doctor when it's at a different stage. But those initial stages can be done very quickly because timing is so important. I want to ask Vedette, because she sees it from a lens from strategy, and she knows about the infrastructure and all the different the technology viewpoint of how to actually make these things happen. I want to ask, what are the key considerations healthcare organizations should keep in mind when deploying virtual care applications?
Mm. Grant, thank you for that question. And thank you for having me back. I'm excited to be here. It's discussions like these that create for the continuous evolution of virtual care. So I'm sure many of you are watching what happened to United Health 6 days ago. And if you're not,
Mm,
they were compromised by a cyber criminal named Black Cat. And these criminals are very smart. You know, they're getting more and more sophisticated by the day. They got into their insurance claims and pharmacy processing unit, and the entire operation has come to a halt. And we know from history that operations like these take about 30 days to restore. And I feel for the patients who are waiting on their claims and for their electronic pharmacy refills, right? And I share that story with you for a reason. You know, 2023 was an interesting year. We hit some records, and not good records by any means, right? Industry wide, we saw a lot of companies get hacked. It was an all time high in 2023. And specific to the healthcare industry, it was the highest we had ever seen. And in particular, just keeping a lens and a tab on the high breaches in terms of the impact and revenue and customers and patients, we had about 725, just the high level breaches. And that equates to about 2 hacks a day for major companies. That's where we are right now. And it's scary and it's unfortunate, right? And so Ronak touched on this. I think the key consideration right now for a lot of healthcare companies is really cybersecurity and data protection. It always has been top of mind, right? Any organization, healthcare or not, if you have consumer data, if you have patient data, this is top of mind for you. Because believe it or not, data is actually the most expensive commodity on the market at the moment. And that's where we are. Um, and with that presents another interesting topic for conversation is the advancement of AI. We're all excited about AI, but AI has actually accelerated the path for cyber criminals.
mm,
And so there's a huge effort as to how do we now use AI to combat that, right? And it's coming. And there's also a huge legal jurisdiction calling in place in order to fight these cyber crimes. Um, and to take it even deeper, we have cybersecurity and data protection, but there's also data privacy. And data privacy is a whole different element. And I'm going to share a really funny story with you. I work with a lot of trichologists, and just about 2 weeks ago, there's this new device that I wanted them to test, and I offered to be the guinea pig. And I was sitting in front of my peers and colleagues while they were using the TrichoView to kind of go through my hair and look at the scalp analysis. And I have healthy and beautiful hair, so I want to think. But there was this one spot that was detected, and my quick reaction to the trichologist was make sure nobody sees that, right? And in that moment of vulnerability, I realized how much data privacy means to patients and consumers in general, right? Whether you are dealing with a small minor scalp condition or a terminal illness or a chronic illness, not everybody needs access to that data. And so, what that means for organizations is putting the right controls in place to make sure only the people who absolutely need access to the data have that data, but also educating people, right? And helping employees in organizations raise their hand and say, I really don't need to see this data. How do I take it off my, and that is an education aspect. So I believe those are things that are really top of mind right now. 2023 was an interesting year. I hope it does not continue in the trend that we've seen, and there'll be more controls and more to follow in place.
Wow, you bring up some very interesting points around the cybersecurity threats that are very, very real. And I think it gives people angst when you think about expanding their virtual or their digital footprint to to include things that are outside of their control when you start thinking about virtual care settings. And I really like how you brought that to the forefront and how we can really how can we mitigate some of these issues, because there's the positive of virtual care and then there's that negative that you don't want to be vulnerable. I want to ask Ronald, because you are a developer, and if you could share a real world example of how Agile InfoWays has successfully navigated virtual app development challenges, such the things that Vedette has brought to the table.
Sure. So let me give you 3 or 4 real-time examples that we are part of the actually technology implementation with various companies in US. One is the uh, treating the diabetic patients. I think even we spoke on this last time as well. See, diabetic patients, if they have a wound, we have designed this whole solution, which is a virtual care solution. They can come to the system, they can take the picture of their wound and send it across to the software they've designed, and then we have AI algorithms which are doing the diagnosis of this wound, and then it gives the results to the doctor right away. Okay, now this is all diabetic patients. If the wound is very severe, the system would tell right away that you need to call 911 or you need to contact the emergency center right away. But if it's a treatable wound, the AI algorithms will take all the results, send it to the doctor, and doctor would be able to treat directly through the virtual care application. So Dr. Eric said that very right, that we cannot wait on some of the things for 5 days for a patient to call in. Some of the things has to be treated very well. And designing this kind of solution, it's all about patients' data, privacy, cybersecurity, HIPAA compliance. So we have to comply with all these standards when we are taking all these images of the patient's wound, and patient's data is being traveled across from his handheld device all the way through the software that we have designed. And there's another solution that we have designed. It's a pure remote patient monitoring system, which is already implemented to 30 centers right now across in the New Jersey and New York. Now, here, what we are trying to do is, once, let's say, the patient is in the hospital, once they get discharged from the hospital, or sometimes patient would come in, but they don't really need to be hospitalized. We still wanted to monitor those patients remotely to see how they are behaving. So once they leave from the hospital or they are at home, we basically monitor their data, like we monitor blood pressures, their glucose, we even monitor their weights, the body weight, the pulses, and everything is being sent live to these remote patient monitoring facilities. And based on the medical history of the patient, we have done a lot of AI work on it, where if there is the different activities level in this measurements that we are taking, or if there are any vital signs, we put the alerts directly to the remote patient monitoring system, and these care providers will speak to the doctor. So we have a lot of alerts solution systems designed, where the patient will also know, patient's relatives will know that there are so many different things are happening. So this AI is helping a lot to monitor the activity of the patient, even if they are not in the hospital, even they're at somewhere else or at home. We monitor all this data. Now, at the same time, we implemented AI on the billing side of the remote patient monitoring companies. Now remote patient monitoring companies cannot bill the insurance company the way they want. So we have designed this whole session log systems, and this session log system basically acts so smart. It really finds like how much time this healthcare providers or remote patient monitoring team is spending per each patient. And based on that, the session log will basically bill the insurance company. So it's all fully automated solution, which really takes care of the healthcare providers and the patients both at the same time. The third monitor, remember I told you in the previous question, we implemented one solution in 1,200 hospitals in the COVID time. That was all doctors on call solution. Now that was a big hit for even our company, because we had to do this implementation in 2 months of time and manage everything in terms of the scalability on the AWS side. So that's where the whole big challenges come in, because healthcare is healthcare is such a field that every company that we work with, they want everything tomorrow, and that's not possible, right? Because they always are in crunch on the timeline, and I need this by tomorrow. But that was a big challenge where we really made it happen. In those 2 months time frame was actually shortened by about 5 weeks by us, where we implemented in 1,200 hospitals everything into the AWS infrastructure, because it's all about video conferencing of the patients and doctor all day long. And then we integrated a lot of SMS integration, a lot of automation that would take place, for scheduling, billing, and everything was fully automated. And the fourth solution that we have implemented is the IoT based pill solution. Like we have these pill bottles that we get in US, and the cap of that bottle is completely IoT enabled. So we monitor the patient if they've taken the medication on time or not. As soon as they open the pill bottle, our system knows that, okay, now they've taken the medication. So in the daytime, if they've taken it 3 times, if they don't take it, we alert to the care providers that the patient is missing the medication, and then we alert the patient, and then we are trying to now integrate something called Uber Care into that solution as well. If the patients are staying alone, if nobody's there, we will have the Uber Care go and speak to the patient at home that you're missing the medication. So this kind of systems we are designing and developing in, which is more about virtual healthcare. And definitely every day we see big challenges. The way we did mention, it's all about these hackers. So AI has to become more smarter to even prevent the hackers to come and hack the system. So those are the bigger things for 2024. It's all AI world, and we are working towards very larger solutions of bringing the more security into the systems.
Well, you're doing a fantastic job. Thank you for those real world examples of how you're enabling virtual care to reach our communities, especially in short time frames, and being able to manage through all the different regulations that are required to make things work properly. I want to swing this over to Dr. Eric, because now this is new, and there's always resistance to new things. People want to check it out first. There's some early adopters, but the bulk of people may be holding off and like, well, let me make sure this is going to work. So have you encountered any resistance from patients or staff when adopting virtual care? And if so, how did you overcome that?
That's a great question. So there's resistance on multiple fronts. There'll be resistance if you think about virtual care, resistance from the provider end, and also resistance from the patient end. We have to kind of separate those two. So looking at resistance, just starting from the provider end, for example, one has to take into account education. How do we properly onboard the providers into the virtual care world? What level of sophistication from technology perspective is that provider, their staff? Do they have the right workflows? Did we design the virtual care workflows? Did we begin with the end in mind and actually think of the provider when designing it on a front end and their team using it? That's one end of why a provider would have resistance. Like, whoa, does this fit into my workflow? Number two is the unit economics. So again, beginning with the end in mind, when you have hardware, software, you have to figure out, does the unit economics make sense for the provider, right? Who will they have to hire? Any ancillary team, a medical assistant, a nurse practitioner? Who will be leading that? Will it be the provider themselves? Do they have enough time for that in their schedule? So that's one kind of level of resistance. And it's easily overcome with great companies who begin with the end in mind. Second resistance is from patients. And in the beginning, I'm an early adapter. And so, like 2017 is where Medicare approved, I believe, RPM, and we jumped on that right away because we saw the value. And so, there isn't much resistance from patients. Patients embrace virtual care. It comes down to the unit economics. Are they going to have to pay for that hardware? Are they going to have to pay a subscription? Is it included in the services where the doctor charges them? But if the unit economics make sense, it really, really is taken well by patients and their families. Barriers to adaptation of technology also depends on age. So, back in 2012, around 13% of people who are 65 and over owned a smartphone. That's in 2012. In 2021, 61% of people 65 and over own a smartphone. And there's new data that show numbers north of 85% plus now that own a smartphone or digital technology. And so we see that we are moving from Blockbuster to Netflix. We see that patients are embracing that change. They're embracing the fact of how easy it is now to get access to care, how easy it is to transfer their data. But I have to agree with Vidette. She mentioned some really key points. United, but then there's also Change Healthcare that got hit 2-3 weeks ago, and that's from a cybersecurity perspective. It's a platform that one of the things they do is check eligibility of patients. And so, can you imagine thousands and thousands of offices who want to see new patients? They can't get that eligibility checked. So you can't see somebody because you don't know. Can you imagine if you have a hardware device that controls the amount of insulin that is being, distributed within your body, and then someone hacks into it and says, instead of 50 units, I'm going to give 100 units unless you give me $1 million, and I'm going to do it in the next 60 seconds, right? So cyber needs to be top of mind when developing these platforms and hardwares. Especially, last thing I'll say, I was asked maybe about 12 years ago by a venture capitalist on a roundtable, where do you see healthcare going? And 12 years ago, I said, the fusion of man and machine. That was 12 years ago, right? And now you see with Elon Musk and others with a Neuralink, right? So cyber becomes so much more important if you have a chip in your brain that controls what you're able to do. Those are really top of mind items.
Wow, you say top of mind. You mean that? It is
No
top.
pun intended.
It is top of mind, man. It was so science fiction as we think through these things, but we're looking at neural links and things like that. Is it good? Is it bad? There's a lot of questions. There's a lot of answers, but does it overall, is it going to make a positive difference for a lot of different people? And one of the things that always come up, and I'm going to ask this question to Vidette because it's so important. Help us understand the role of data analytics. I've heard a lot about analytics, predictive analytics, all these things, and enhancing security and efficiency of these virtual healthcare services. How do you see the role of analytics in everything that we're talking about today?
Mm-hmm. Grant, analytics has a crucial role. And, when analytics has bubbled up into big data, right? And I don't think we've done everything we can, and data, it has an interesting journey in healthcare. There was a time when it was a closed system because everything that accumulated data was within the hospital or in the doctor's practice, right? But now data is coming from everywhere. Biometrics, like Dr. Eric and Ronak have said, data coming in from the health labs, prescriptions. I mean, there's data coming in from all directions and flowing in all directions, right? And so that's different. It's exciting, but it also comes with risk. And part of it is making sure that as this data, patient data is moving across systems and from one recipient to the other, it is all encrypted and protected during transmission. And when it finally reaches its destination, that it's kept in a safe place and in a safe vault. And so, from a cybersecurity perspective, there's actually tools out there that can monitor the way the data moves and the trends and the patterns. And if people see anything different, it's a question that needs to be asked. And I think incorporating more of those security data analytics into the healthcare system is coming. It's already here and is going to continue to come. From an efficiency perspective, I love what you said, Dr. Eric. We're all here to impact the lives of people. That's really why we're here. It's that simple, right? And that phrase actually gives me goosebumps. Um, there's all this data being accumulated, and we're still amassing data and trying to figure out how can we predictively tell you what your quality of life is going to be 10 years down the road, 20 years down the road. And I think that effort is still ongoing, and there's a lot of value in data analytics there. I recently did my blood work after many, many years. I should be ashamed. But I logged into, I believe my provider is Aetna. And now Aetna gives you your lab results by year, and you can see your glucose level, for example, your sugar levels, year by year by year. I did not have that 10 years ago. Progress in the right direction. But I think the next evolution is taking something like that and saying, Virat, with the track record you have and having looked at the data of patients before you, this is what your trajectory looks like, and even more. In order to prevent that, here's what you need to do from a preventative fashion. And I think data analytics has a lot to do in that journey and storytelling proactively as we continue to move forward. I'm pretty excited. I think this is a funny joke. And I have a 13-year-old daughter, and she asked me, why do we call big data big data? And this was my simple answer to her. It's so big, we still haven't figured it out, and we still have a long journey to go. And while it's a simple answer, there's a lot of truth to it. I still think there's a lot data analytics is going to do for healthcare going forward, especially in combination with AI. That journey is going to be even faster. And so I'm pretty excited.
I'm excited. I'm glad your daughter is excited. We expect her. I tell people all the time, our young people especially, you know why you're here on this planet? Like, why? You're here to change the world. Simple as that. Our world that we've already experienced this world. We've already developed our experience. We're moving on to other experiences. You are here to change the world. So we want you to take this data and utilize it for the common good for all humanity and make it better. So as we move into Netflix, we used to know Blockbuster, so hopefully you won't have to go back and experience that when there's so much other things that you can do. I want to talk directly to our audience because we've discussed some critical errors, of things. And I want you to think about this. Which topic so far do you find most relevant to your current role, your experience? Now, was it the complexities in development? Is it real world applications? Or is it the future trends that's got you piqued with curiosity? I want you to write into the comments and we'll take a look at what you've written there and we'll go ahead and engage that with the team so we can see if we can get some answers for you. But in the meantime, as you're doing that, we're going to turn this discussion back over to Ronak Shah because you're right there in the middle of it. I mean, you're actually developing and engineering the tools that are necessary to make these innovations happen. So from your lens, Ronak, what innovations do you foresee in virtual application development? And how is your company, Agile InfoWays, preparing for these changes?
Sure, Grant. So, Grant, virtual healthcare application is all about now easy accessibility, personalization, and automation. And let me explain you some of the areas that we are focusing on as a company, and we are also developing a lot of solutions. So, first important part is the AI-driven diagnostics. Now we have availability of large medical data sets. Based on that, the diagnosis is much, much, much better. Now, you can predict the outcomes, you can recommend the personalized treatment plans to the patients based on this large data sets. Now analyzing the medical images is so important. Remember, I told you the diabetic patient example, the wound example. We do the analysis of this medical images virtually, and then we match it with the different level of patients records. We check the genomic data, and based on that, we avoid patients to go to the see the doctor physically, and are able to do this through AI diagnostics directly. Now virtual reality has a crucial role into what we are doing right now, is because virtual reality, the it's full remote consultation that would take place. Like, a lot of patient has to take daily therapies, therapy sessions. All these therapy sessions are being done virtually now. The third important part, for let's take a real time example of a kidney patient. Now the kidney patient is going through a dialysis, and they have to go twice or three times in a week to the actual center, dialysis center, to get the dialysis done. Now, these same patients are able to do the dialysis at home, and the virtual reality, the healthcare providers are able to help them directly. So, it helps them not to go to the facilities. They really feel sick when they see this many patients every single or every other day. If they do it in their home, that keeps them into the stable mind state. At the same time, virtual reality helping them to learn and do it by themselves. These IoT enabled devices that we spoke about, this we take a lot of data from the wearable devices, the smart sensors, the home monitoring devices, and then we are able to monitor the patients directly through their activity levels, or if there are any vital signs, we alert them. So it's all these IoT enabled devices. So all these innovations are helping patients to go through a journey into the better shape. Now coming back to the VDEC thing, this data analytics and security. Now we started working with the blockchain, and this blockchain technology has helped us to secure the data. We are able to uh, do this more like a decentralized platform for storing and sharing the data, to ensuring patients' privacy and security. So that is also very, very important. Well, when data is being secured or stored at some places. Now, this telemedicine platforms. Now, this is a very, very important thing that telemedicine platform has incorporated. See, US is a country of migrants. We have hundreds of dialects or hundreds of different languages are being spoken in America. I know the primary is English or maybe Spanish, but let's say some Spanish patient need a virtual care right away, and they're not able to find a Spanish speaking doctor. We will still are able to bring the English speaking doctor on the call, and then we have a real time language translation that takes place in this telemedicine platform. So patient speaks in Spanish and doctor answers in English, but even it's a real time translation that takes place, everybody they're able to understand. So it's very, very important. This a kind of innovations are coming into the world. Even in this telemedicine platform, we have a gesture recognition. We even are planning to even detect the emotions of the patient and send it to the healthcare provider. So the world is moving to a whole different era that we probably never thought in the past. Now a lot of the other things which are coming up is all the genetic data of the patient. We are able to do a lot of analysis and data of their medical history, their lab results, their genetic profiling, and based on that, doctors are now suggesting better plans for the treatment. And so AI and virtual reality and IoT enabled devices, a lot of innovations are coming up, and we are involved in pretty much every area of developing a lot of bigger solutions right now.
Man, I can't wait. I want to live in your world. That sounds like a great world to be in, and definitely from that communication standpoint, we all know we have different languages, and so we don't want that to be a detriment when you're trying to get, especially things that are timing is so important. We have a question that came directly from the audience that's directed to Dr. Eric. This is Stephen Mullen. Stephen Mullen says, based on existing technology, how many patients can be simultaneously monitored by one technician using RPM?
So it's a very, very good question. And it depends on what technology you have. So if your remote patient monitoring technology incorporates AI, artificial intelligence, then you're able to monitor many more patients because now you have AI doing the actual vetting of what a human being needs to look at. If you don't have that, then you could see less number of patients. Now, it's hard to generalize because every practice, every physician, it depends what you're monitoring. If you're monitoring hypertension versus heart rate, which is versus pulse ox, that will change the number of people you can have on your panel, quote unquote. Generally speaking, anywhere from, again, if it's very simple and it's a population of the general population and not a population that is very, very high acuity population, high risk, but a general population tends to be 100 to 150 to 200 patients that one care coordinator can monitor. If, again, it's a general population, if it's higher acuity, someone who has CHF, someone who's a population that has uncontrolled blood pressure in the 180s, 190s systolics, and you have 100 of these patients, obviously you can't have 100 people who you're monitoring. So it really varies based on the complexity and the level of AI that you have within your platform.
Interesting, interesting. And we had another question that came from the audience from Trina Moss. She's a PhD, and she asked, and this question is for Vedette, how can we alleviate the fears of data analytics as it relates to people's beliefs that data will be used to exclude them from insurance coverage, jobs, and etc.?
That's a great question, and it's a deep question, right? Truth be told, there are concerns around AI and even data analytics, right, as to how much bias is really in this box and how much is it really being used to the advantage versus not. And I think we're going to have a couple of discoveries. If the question is how do we get people to embrace these technologies knowing that, I think the answer is to focus on the good that can come out of it, right? Focusing on what it is you can get from giving your data to someone. Um, you know, could it be misused? Absolutely, yes. But the fact that you can get a predictive analysis from a doctor, the fact that you can prevent a future condition, right? Is it worth the risk? Absolutely, yes. And that's the conversation we need to start having more of is what can we prevent from a disease perspective? What can we help you educate on, in your community so that we can kind of prevent the illnesses that are kind of linked to genetics and things like that. There's a lot of power behind that, and data can actually tell the story and prevent it from happening. And that's the story we need to be focusing on.
This is getting very, very interesting because we're getting to that area of the unknown. We're not
Mhm.
sure exactly the impacts that will come out of this when you introduce even more technology into the situation, and what is the variable of what's human decision making as opposed to machine decision making that's going to affect the patient experience. I think these things are very, very things to we have to consider all of these things. I wanted to ask Rona, as you're seeing, you're hearing these conversations, you see all these things. What do you see? And you've talked a little bit about how AI is influencing the future of virtual healthcare, but can you give us some more light in that area? I mean, you don't want the machine making all the decisions, but you want some automation, but there's got to be a hefty balance. How does that work out?
Sure. So I mentioned a couple of scenarios in the last question where we have AI based diagnostics, or we take a lot of data from IoT and we send it to the remote patient monitoring systems. There are a lot many other more innovations that we haven't discussed. One is AI powered assistant, which is virtual assistant, and chatbots. Being a patient, you may have so many simple questions where you don't want to speak to the virtual care provider every time. So these chatbots are way smarter. They can answer your number of simple and complex questions. These virtual assistants even gonna be your assistant. They're gonna remind you for medications. They're gonna support you, even manage your chronic conditions. So, those kind of AI powered virtual assistants and chatbots are coming into the world, which is very important. Now, the another part is the healthcare resource optimization, which AI is bringing. What it means is, let's say in the real world scenario, we really need to find out, okay, for next week, how many resources we would need in the hospital, or how many staff members we would need in the hospital to run it, because every week the behavior is changes. If there are natural calamities, there are different things happening in the world, and which part of the world that is happening, you could have a lot of inflow of patients, or you may not have that much, or maybe some kind of viruses which are coming up, whatever it may be. So this AI is able to predict that by looking at the weather conditions, the different types of news they do analysis, and based on that, they would say that in the next 1 month, this is the number of people that you would need even run your business, or run your hospital, or your remote patient monitoring systems. So this whole resource optimization is coming from the AI world. So AI is going to predict everything for you, that this is what you would need for next 1 month, as far as the number of people that would need to serve the patients. Now, this healthcare data analytics, which Fred we did talk about, and this healthcare data analytics is bringing a lot of AI into it. Now this AI is, as I discussed, there are a lot of machine learning, and we have a lot of data that is being analyzed by this machine learning, and it identifies the different trends and patterns that are going into the real world. And based on that, they know now what were the food habits before 50 years and what are the food habits of people now. People are making changes. All this food that we store in the refrigerator and we use it, that was not happening 100 years back. So the life pattern is changed, and based on changes of this pattern, these machine learning algorithms would tell you that, okay, in 2024, we had this much of heart attack rates. In 2028, heart attack rate is going to go up by 5% or 7%, or is it going to go down? So all this healthcare data analytics is being done by machine learning algorithms. So a lot of AI innovations are in the process coming in, and a lot of bigger companies are implementing into their solutions. I'm pretty sure we're going to see a lot of those solutions in next week in the event in Orlando, where we're gonna be in the HIMSS Orlando event.
It's
We will
true.
see a lot of
It's
bigger
true.
things. Yep.
Going to be some great innovations that are coming out. We're going to be there. We'll be at the AT&T booth. Hopefully, our audience, if you're going to be there, and come by 2261, I believe is the booth number. We'll be able to demonstrate some of this technology. We have a great remote patient monitoring application that was developed by Agile that we'll be able to demonstrate to people coming by. I want to swing this over to Dr. Eric, because the audience may not realize this. Not only are you a physician, but you have developed and actually ran a company and are running another company that does remote patient monitoring. So you're living in this world. Give us some understanding of what does that look like from a compliance standpoint, and as you look into the future, what kind of new developments would you like to see that you will be able to implement to even take it further?
Uh, Thanks, Grant, for that question. I'll tell you for sure, from a compliance perspective, a lot of the things that Ronak had mentioned, from HIPAA to cyber, those things are really, really important and not easy. That's a lot of barriers. And so working with the right developers, working with the right companies who can help in that is super important, right? You can develop a great product, but if you don't know anything about cyber, you don't know anything about fire, you know anything about HL7 or any of those things, then it's all it won't work. You're building on quicksand. We've also seen that, it's really important from a tech perspective to get provider buy-in early. And in order to do that, you need to make sure that the technology, as I mentioned earlier, has them in mind. You need to make sure that you're thinking like a provider. You need to make sure that you're actually, the lenses that you're wearing is not of a technologist, but of a doctor, of a nurse practitioner, of a physician assistant. How are they seeing the world? So to you, it may be like, oh my God, this is incredible to do remote patient monitoring. I have this great product. It's incredible. But to them, it may be like, look, I'm already oversaturated in the office. I'm seeing 40 patients a day. And you're coming to me now with a solution that I'm going to get alerted every 5 minutes when my patient's blood pressure is a little elevated. I don't have time for that. So we've, like I said, I was an early adapter to both using it in my practice and
Mhm.
also to then helping physicians use this. One of the things we've developed early on was chronic care management platform. And Ronak knows very well about CCM. It's a platform that allows people, provider offices, to spend an X amount of time with patients and get reimbursed for that. So Medicare said, you know what? We rather pay a small amount for a doctor's team, not even a doctor, but a doctor's team to speak to someone for 20 minutes every month, say 40 or $50 a month. We'll pay the doctor or his team. But if it can save us one ER visit or one hospitalization, it for sure is worth it. Right. But now explaining to the physician compliance, how do you bill? How do you do all the modules? That's an art. Working with developers like Ronak to make sure that there's understanding, working and getting consulting from folks like Vidette about, hey, how do I design this from a cyber perspective? Those are some of the growing pain challenges that we've experienced. Where I see things moving really is, like I said, from Blockbuster to Netflix, from where you're seeing your doctor. Like, think about this. How many of you guys do telebanking?
Yeah, yeah.
But do you call it telebanking?
No,
What do
I
you
haven't
call
heard.
it?
I call it online
Banking.
banking.
You
Yeah,
call it banking.
yeah.
So if you needed to do something right now, you're not going to say, oh, I'm going to telebank. You're going to say, I'm going to do this bank transaction and transfer $500 to Ronak, whatever it is, right? Telemedicine is telemedicine today. Telemedicine, the word will disappear. It will
Mm.
be medicine.
Mm.
Ah,
And so that's
Wow.
that's that's where I see the future going from telemedicine to actually it being the norm of medicine.
yeah. It'll sound ridiculous in 5 years. Like what?
Yeah, telemedicine.
That I like. I want to ask Vidette. You sit in the seat of today's chief information officer. Now they're also called chief digital officer, chief innovation officer. And almost to what Dr. Eric just said, are they seeing this now as just more stuff that I have to manage? There's more IP I've got to look at. You've expanded my threat landscape now with all this new stuff, and I don't really see the benefit of doing all that stuff. Is it really moving the needle? I mean, when you think about all the compliance and of all your regulations, I mean, what's your viewpoint from your industry and your seat? How do you see this playing out?
Right. So, regardless of title, they're all kind of roles that are kind of coming together, right? Before in the past, there was the business side of things and the technology side of things. And today it's all kind of morphed into one. And honestly, I think because there's very little you can do without technology. Healthcare or banking or whatever have you, right? Everything is technology driven and it's become one world. The role is definitely more challenging today than it ever was, right? And I think it will continue to evolve that way because we're moving really quickly. And it's exciting in a way because I remember back in the days you would wait for 5 years to see an advancement, and now you kind of wait like 5 days, sometimes even less, right? That's how quickly we're moving. So it's an exciting time. Um, and when you think about moving forward and how this is going to continuously evolve, right? I think Ronak and Dr. Eric have already hit this nail on the head and quite accurately. So I think we're moving faster, and I think that the magic is going to be in continuing to keep things simple and secure.
Mhm.
Right? Security is always going to be paramount, right? And simplicity is going to be key. And here's something, during the COVID, I was working with a company that was, like Dr. Eric mentioned, looking to do more remote monitoring for the heart because after surgery, people didn't want to be in the hospitals during COVID. They wanted to go home and be monitored. And so there was this local company that was working on heart monitoring. And one of the things, and it was made possible, by the way, it was very much possible at the time. But one of the things the patients did not like about the technology, the little stickies that they would have to put on their chest, is for one, it used to irritate their skin. Sometimes once they removed it, there was a little bit of irritation that kind of stayed on. But believe it or not, they just didn't know where to stick it because the monitoring patches had to be very precise in order to pick up the information and transmit it back to the doctor. And so it was actually hard to help them, change the little stickies day in, day out. Fast forward, what we have today is a t shirt that you can wear and it actually transmits the signal back to the doctor. This is actually in the market. It's not readily available because of cost, but it is there, right? How easy is that? Everybody knows to wear a t shirt, right? And the great part is you can even wash it. And that's what I mean by use. And that's what I think about when I think about infrastructure. Infrastructure is now becoming, when we used to think about infrastructure, we used to think about these hard, tangible objects. And it is now becoming soft. And
Mhm.
it is in every interaction of the patient, right? Whether it's a watch you're wearing, whether it's a t shirt you're wearing, whether it's there's so many out there. The little aura rings. I mean, there's so many out there. And so I think that is what it is going to be the next wave is how do we keep these things simple and yet how do we protect it in that journey?
These are so important. You bring up wearables, which sounds so cool, right? But not just wearing clothing just for its fashion appeal, but for its ability to just like you get in your car today. You get in your car, you turn it on, you go down the road, but you see all these dials, just constantly measuring the performance of the vehicle and letting you know, hey, you need air in your tires. Hey, your battery is low. Hey, you need oil. We don't have that, right? I like that analogy you just brought up, that as we start thinking about having, when we are, you know, getting up in the morning and just putting on our everyday, clothing and that type of thing to go out and meet our world, that we're actually being very, very conscious about making sure that we have our health monitoring system with us. We're very beginnings of this night with the Fitbit, right? You have your little Fitbit. Now everybody has a cell phone, to what Dr. Eric just talked about. First it was 60%. Now we're at 85%. We're talking about the elderly population. Like, hey, they most to be supposedly the least least amount of technical knowledge in our elderly population. But I think that's rapidly evaporating. Say, hey, I know my mom. She's plus 80. She can jump on a Zoom call or anything like that in a heartbeat. So that gap in skill set is lessening. And now we're starting to see, hey, especially with the aging population. Me and Dr. Eric did this about a year or so ago, talking about age tech. What does that look like? We have a very older population in the US that's going to drive our healthcare costs through the roof if we stay in the same model. We've got to change the model. So I see these things. We've only got 45 seconds left. I want to first say thank you. Thank you for everyone. And if you've got anything else you'd like to let our audience know, you've got 10 seconds. Go, Roanoke.
No, I think this is. I would like to thank Dr. Eric and Vidit and Grant for bringing up the great questions. And it's really important the world to know where the healthcare is moving. So even for the audience, be prepared. A lot of changes are coming. Dr. Eric mentioned it right there, from Blockbuster to Netflix. The whole world is going to change. We see these electric cars, all autopilot, right? We never thought of that car is going to be automated. We just go and sit there and put your hands on your steering wheel and you go from one place to another place. So things are changing rapidly, and be prepared, be educated.
Well, thank you so much for all of you being on the panel today. I'm sure our audience got a lot of great information out of this. You can connect with each one of the speakers in the chat or in the comment section. You'll see all their contact information, and I encourage you to reach out to us at any point in time. So thank you all for being on the show today.
Thank you, Grant. Wonderful
Thank
show.
you.
Thank you, everybody. Ronak and
Thank
Vidal.
Thank you,
you.
everyone. Dr. Eric Ronak, very nice. Great
Thank
discussion.
you.
Bye-bye.